I met them there, and for the first time in my life, I experienced immense feelings of failure. Walking into his ER room, seeing him hooked up to a number of different machines, one in his nose, IVs in his arms and hands, and a tube down his throat, and my parents. My parents standing in the corner with tears in their eyes, holding each other and asking God to please save their son. It was in that moment that I realized I had failed him as his big sister. I was always thought to be his protector and someone to guide him on his journey into his teen years, and somehow, somewhere on that road, he had gotten lost. This event fueled confusion and sadness and hurt and despair within our family unit surrounding his addiction. My parents were lost and deeply concerned for his well-being, and after searching in what seemed like 100 programs, they found a place for him in Jamaica that offered answers to his behavior, his use, his anger, and trauma, and they transferred him to that center. For me, it was bittersweet. He was here one day in all his turmoil and gone the next in treatment, living this empty hole in my heart. I was new in college, fresh in the world, and trying to make sense of my own life, and it was at that time that I made the decision to change majors and become an AODA counselor. I had wild dreams of saving the world from addiction, one teenager at a time, of being a sounding board for other sisters and brothers and moms and dads. I wanted other families to be able to heal and grow and to be able to find systems that would wrap around them instead of not knowing what to do next and where to turn, such as my family had endured before my brother entered treatment. My brother returned home from treatment, but as many of you can guess, his addiction followed. He was enrolled back in our local high school, and before graduating 12th grade, he was known as one of the largest marijuana dealers in Dodge County. My parents attempted to get him help in many ways, but as we all know, parent support, resources, and education is very hard to find. My brother, of course, was given the DARE and Just Say No speeches at school. We all know how those work. I am a product of those programs growing up in the 80s and 90s, and I did not find recovery until 2004. In case I was unclear, those programs, they don't always work. They, like many other programs used in our school systems today, were created out of a broken system. That same system that has failed many members of this community, like Logan and Archie. My brother quickly turned from marijuana to alcohol, to cocaine, to crack, to eventually using heroin. My brother's use continued for over the next 20 years. In 2018, he became homeless. I made the choice to allow him to move in with me and my kids. In August of that same year, he overdosed on my living room floor. My son, Kellen, he was 12 at the time, and he found him. My brother was blue and he was unresponsive, and my son and my daughter watched as I reached back into my kitchen cabinet way in the back and fumbled with a needle and Narcan and injected it into my brother's lifeless body. They cried in the corner, and I'm pretty sure I had this out-of-body experience as I screamed, "Wake up, wake up." I tell you this because I'm a lucky one. I do not carry the grief and pain that many of these parents sitting out here do. My brother, he was saved by Narcan. When I think about moments in my life that I know I was in the right place at the right time, it was that day for me. My kids, they will have PTSD from that day forever. They carry it with them, but with my brother, we have healed. He was given a second chance at life. From that day forward, I made the decision to help those who are still struggling with this disease gain access to Narcan, no questions asked, with no issues with funding and no hurdles to cross. I do this through my work with ServeURX and my nonprofit. The night of my brother's overdose, he was taken to a local hospital, that same hospital I sat in so many years prior when he first overdosed at the age of 13. As I was sitting there, a mom came in. She was given a prescription for an antibiotic for her kid, and she got it out of a vending machine. I sat there and thought, well, how genius is this, and why are we not doing it with Narcan? So I went to work. I contacted the only pharmacy I knew, which was ServeURX, and they're now my employer. We funded a pilot year and put 25 oak boxes out into the community, and that has now grown over to 500 boxes here in Wisconsin, and an additional 210 nationwide. We install in high-risk areas, and our main focus coming into year 3 is our schools. Students today need a different approach. Their parents need more resources, and our schools need support to tackle this epidemic. This is why we are so excited to get these oak boxes placed out and into the community in the public eye, so Narcan is just as accessible and visible as anything else, like an AED machine or an EpiPen. SHN has chosen to partner with Love Logan Foundation. The amazing Aaron and Rick from Love Logan, they're here today. Together we are working to create harm reduction efforts during the 2023-2024 school year by installing these oak boxes throughout schools and developing our youth professional training program. We will be providing education, Narcan, and plant oak boxes within high schools and youth-serving organizations to support harm reduction efforts. SHN and Love Logan, we're on a mission. We are excited to be part of this effort right here in Aaron and Rick's community in Waukesha County. Love Logan believes in educating youth prevention of harmful drugs, and SHN believes in providing tools to reverse an overdose or fentanyl poisoning. Together, we are making history, not only in Wisconsin, but throughout our nation. Please take a look at the oak boxes if you haven't already. What's in them, Narcan, information on how to administer the drug in emergency, other information and resources impacted by the opioid epidemic, breathing masks, Disposer X packets, fentanyl testing strips, gloves, information from our partners. So again, they're hung up in high-risk areas such as gas stations, homeless shelters, hotel recovery centers, high schools, colleges, banks. Anywhere and everywhere, we will hang an oak box on the wall. In closing, my brother, the man who society says isn't worth reviving when he overdoses, the man who the internet trolls will quickly toss to the curb or write horrific things about due to his disease, the man who some call a moral failing, that man will celebrate 5 years of recovery in August. Because of Narcan, his life was saved. Thank you.
So now you know why. And the amazing thing is we're not just stopping with the schools. When I met with Jessica and Aaron and Lori, and we were talking about this and the opportunities and the possibilities, the goal was to say, where can we put these? Where can we make them accessible? And so we started reaching out to our community partners and asking them. And the commitment by the county is we are going to purchase in this next year over 100 of these boxes. And our goal is to install them in any partner that's willing to have us. And so one of the partners that stepped up right away was the city of Oconomowoc. Former Alderman Lou Koyeski and I have known each other for many years, been involved in many things, and Lou said, you know what, I can get the mayor on board, we can get this done, and we can work towards this. And so they are one of our first partners. And it's amazing when you listen to the conversations we have, it's not just getting it to the community locations, it is getting it out into the bars, getting it to the areas that are the impact point, that people will feel comfortable knowing I can pick up a Narcan box there, I've got a friend, I've got a family member, I've got a loved one that I want to make sure has a second chance. And so what I'd like to do now is just have Mayor Bob Magnus from the city of Oconomowoc come up and tell a little bit about his side of the partnership. Mayor?
First of all, Jessica, thank you for sharing your story. It was very powerful and a big part of why we're here today. I want to start off by thanking everyone who's here today, and to thank County Executive Paul Farrell and the County Health and Human Services team. Many of you are here in the audience for your incredibly important work. It's easy to talk about the problem. It's difficult to implement. You're part of that huge part that helps us implement. This is an important issue for the county and for the city of Oconomowoc. We are not immune to this crisis. Opioids are a serious problem in Lake Country as much as anywhere else in the state and in the country. I am proud to announce that the city of Oconomowoc is working with the county to install 12 oak boxes. Those boxes will be placed in public and private locations within our community. I encourage other municipalities to participate in this program. I also want to take this opportunity to mention the Jump for Archie event in Oconomowoc this coming weekend. It's the 9th annual Jump for Archie, Jump for Life awareness event that's scheduled for Saturday, May 13th from 8:30 to 11 a.m. at our city beach located at 324 West Wisconsin Avenue. The Jump for Archie is hosted by Saving Others for Archie. You heard of that, SOFA. What a huge impact nationally and within our own small community. Leaders of the National Awareness Campaign for the Fentanyl, America's New F Word. Thank you, SOFA. The organization is dedicated to transforming substance use recovery with awareness, ending stigma, and supporting our communities. Thank you again, Executive Paul Farrell, for your leadership on this issue, and a special thank you to Lori Bedora and Lou Kavieski for their work for the city of Oconomowoc to help build the awareness of the dangers of fentanyl. It's time for us all to get involved. And it comes back to my initial opening comment. It's easy to talk about this, but let's do something about it. And I think these are some great starts for us and for our community. I've really enjoyed getting to know Executive Farrell and working more to try to actually have an impact. So let's do it.
So the goal of the program is to build that awareness, to get the information out, to save one more life. That's what we're trying to do. So if you're watching this on Facebook, when you're looking at the news, you can go out to the waukeshacounty.gov website, get all the information that we talked about with the toolkit. If you have any questions, you can send an email to overdoseprevention@waukeshacounty.gov. And our team here will respond and get you the information and get you the help that you need. So we appreciate everybody coming out this morning. With that, we can answer any questions.
How would you go about replenishing some of the boxes? So I see there's boxes and Narcan in them. So is there somebody monitoring them to replenish them when they are being used?
Yeah, so the goal is to replenish the boxes. There are 3 Narcan kits in each one to begin with. As they run down, we're asking our partners, so the city and others will take a look at that. They will reach out to us, and we'll be able to replenish them through the county operations. There isn't a training to have the box in your establishment, but there's some great opportunities for training. They only take about 15 or 20 minutes to know how to administer Narcan properly, what to look for. The key thing to understand with Narcan, if an individual is down and they're not responding, administering Narcan to that person, if they haven't overdosed, will have no impact on them or very little impact. And so our goal is to say, as much as we have AED devices out there for cardiac situations, we want to have the Narcan out there because that could be the life-saving step that we need. So we are using the opioid settlement funds that we received, as this is one portion of what we're doing. The product or the design for the opioid awareness funding was to build awareness or education, and this is one of the components that we felt very important right now to get it out, get the information out on the use of Narcan and the abilities that it has to bring individuals back. Yep, Fred, that's one of the things we're working on. In fact, the kits themselves, when you open the door, it has it in English and Spanish and how to utilize it. And so we're working on more and more ways that we can integrate that into the communities in the languages. All right, thank you all for coming out. Now the sun's starting to come out. We should wait a little bit more and just redo it in about 20 minutes. My staff would love me. Thanks, everyone. Thank you again for your partnership to make sure we can continue to reduce the impact of fentanyl in our communities. Appreciate it.